Today, we are proud to announce several changes to ABIM's program so that the program will better serve your needs and the needs of the patients for whom you care. These changes have been shaped by a diversity of voices from around the country, and I'm grateful to so many of you for lending your guidance to us as we transform ABIM. A lot of that transformation has been led by our governance, and it's my privilege to turn this over to 3 doctors who are practicing in different settings, diverse parts of the country, who have helped us make the changes that many of you suggested.
Hi, I'm Pat Connolly. I'm a board-certified internist in Oakland, California. I'm with Kaiser Permanente.
Hi, my name is Vineet Arora, and I'm an internist and practicing hospitalist at the University of Chicago in Chicago, Illinois.
I'm Dr. Jeannie Marazzo, and I am in my office in Birmingham, Alabama, where I am the director of the Division of Infectious Diseases at the University of Alabama at Birmingham Medical School.
We've really been working very hard to engage our diplomats and the medical societies to learn how to do maintenance of certification in a way that's relevant and fits into our clinicians' practices.
ABIM embarked on the listening tour to really understand what is it that the new pathway should look like. And as part of that listening tour, it actually included not just listening on the ground, like visiting professional societies, but even visiting hospitals. I know that ABIM staff came here to Chicago to visit several community hospitals, for example.
I can tell you that some of the things that we have come around to were really not even on the table early on. I mean, they were sort of aspirational, but they really grew out of extended and very open conversations with diplomats.
So that feedback really led us to rethink the tenure exam. And we began by revising the blueprint or the outline of what we're assessing, and moved from having it be very similar to the initial certification to an exam that was more reflective of the issues that our internists see in their offices and that we all take care of every day in our practices.
One of the things that ABIM has done in order to really reflect this concept of staying current is to revamp maintenance of certification with the introduction of a new pathway that really respects this model of staying current by these shorter, more frequent knowledge check-ins every 2 years as opposed to the every 10 years.
The past few years, we've recognized that asking people to do additional things on top of that, again, didn't always work for people, didn't meet them on their own terms. So instead, what we've done is to open up the gates to consider some of these quality continuing medical education type activities, whether they're meetings, conferences, whether they're dedicated continuing education activities, and that now approve them, or we have approved them for MOC points. And that's a process that has evolved directly as a result of people saying, look, I'm already doing all this stuff. I'm already going to conferences. I already really go to update lectures because I want to be updated in my field.
So we have the ability through professional self-regulation to determine what areas we need to investigate further. We can choose continuing medical education programs that we want to be involved in. We can choose quality improvement areas. And then ABIM can give us the ability to essentially check ourselves. Are we, in fact, current?
And I think one of the things to keep in mind is that we benefit from the diversity of voices that contribute to this discussion. And so, so for anyone who's ever attended a town hall or completed a survey or participated in a focus group, I just want to say thank you, because that's been really valuable, important feedback that we use at ABIM to really meet the needs of physicians and patients.